Welcome back to Health Treatment Center, where we give you the health information you need to protect yourself and your family. What I'm about to share with you about norovirus could save you days of misery and prevent you from spreading this highly contagious virus to the people you care about most. If you've ever experienced sudden violent stomach illness that came out of nowhere, you might have encountered norovirus without even knowing it. Norovirus is often called the stomach flu, but here's something most people don't realize. It has absolutely nothing to do with influenza. This is one of the most contagious viruses on the planet, and it's responsible for over 20 million cases of gastroenteritis in the United States every single year. What makes this virus so dangerous isn't just how sick it makes you, but how incredibly easy it is to spread to others. Let me tell you about Sarah, a mother of 3 from Colorado who contacted Health Treatment Center last month. She thought she had food poisoning after eating at a restaurant, but within 48 hours, her entire family was violently ill. What she didn't know was that she had picked up norovirus. Because she didn't understand how it spreads, she unknowingly infected everyone in her household. By the time I spoke with her, 7 people in her extended family had fallen ill. The symptoms of norovirus hit fast and hit hard. We're talking about sudden onset nausea that can strike without warning, followed by projectile vomiting that can last for days. The diarrhea is watery and frequent, often accompanied by stomach cramps that can be absolutely debilitating. Many people also experience low-grade fever, body aches, and a headache that makes you feel like you've been hit by a truck. The worst part? These symptoms can appear anywhere from 12 to 48 hours after exposure, so you might not even remember where you picked it up. Here's what makes norovirus particularly tricky. You're most contagious when you're feeling the sickest, but you can actually spread the virus for up to 2 weeks after your symptoms disappear. That means even when you think you're better, you could still be putting others at risk. This is why so many families end up passing it back and forth between family members. Now, if you're dealing with norovirus symptoms right now, the most critical thing is staying hydrated. The combination of vomiting and diarrhea can lead to dangerous dehydration incredibly quickly, especially in children and elderly adults. Small, frequent sips of clear fluids are your best friend. We're talking about water, clear broths, or electrolyte solutions. Avoid dairy products, caffeine, and anything acidic until your stomach settles completely. But prevention is where you really want to focus your energy, because once you have norovirus, you're basically stuck riding it out for 24 to 72 hours. The virus spreads through what's called the fecal-oral route, which sounds disgusting because it is. You can pick it up by eating contaminated food, drinking contaminated water, touching contaminated surfaces, and then touching your mouth. Or by being in close contact with someone who's infected. Here's something that will shock you. Norovirus can survive on surfaces for weeks. Weeks. That doorknob you just touched at the grocery store could have viable norovirus particles on it from someone who was sick 2 weeks ago. This is why hand washing becomes absolutely critical. But here's the kicker. Alcohol-based hand sanitizers don't kill norovirus. You need soap and water, and you need to wash your hands for at least 20 seconds, making sure to get under your fingernails and between your fingers. Let me share the most effective prevention strategies that we teach here at Health Treatment Center. First, wash your hands religiously. Before eating, after using the bathroom. After changing diapers, and especially after being in public spaces. When someone in your household is sick, you need to become a cleaning machine. Norovirus requires specific disinfection protocols that most people get completely wrong. Regular household cleaners won't cut it against norovirus. You need a bleach-based disinfectant with at least 1,000 parts per million of chlorine. For home use, that means mixing 1 tablespoon of bleach with 1 gallon of water. This solution needs to sit on surfaces for at least 1 minute to be effective. Pay special attention to bathroom surfaces, doorknobs, light switches, and anything the sick person has touched. When handling contaminated laundry, wear disposable gloves and wash items in the hottest water setting possible. Add bleach if the fabric can handle it, and run the items through the dryer on high heat. Everything that can't be washed should be quarantined for at least 2 weeks to allow the virus to die naturally. Food safety becomes critical during norovirus season, which typically peaks during the winter months. Cook shellfish thoroughly, wash fruits and vegetables meticulously, and be extra cautious when eating at restaurants or events where food might not be handled properly. If someone in your kitchen is sick, they should not be preparing food for others, period. Here's a crucial point that most people miss. If you've been exposed to norovirus, you might not get sick right away, but you could still be carrying and spreading the virus. This is why it's so important to maintain strict hygiene practices, even if you feel fine after potential exposure. For parents, this information is especially important because children are at higher risk for severe dehydration. Watch for signs like dry mouth, decreased urination, lethargy, or dizziness. If a child is unable to keep fluids down for more than 12 hours, that's when you need to seek medical attention immediately. The good news is that norovirus infections are typically self-limiting, meaning your immune system will eventually clear the virus on its own. However, there's no specific medication to treat norovirus, which is why prevention and proper symptom management are so crucial. I want to address something important here at Health Treatment Center. While norovirus is extremely unpleasant, most healthy adults recover completely within a few days. However, the virus can be particularly dangerous for young children, elderly adults, and people with compromised immune systems. These groups are at higher risk for severe dehydration and may need medical intervention. If you're caring for someone with norovirus, protect yourself by wearing disposable gloves when cleaning up vomit or diarrhea. Dispose of contaminated materials in sealed plastic bags. Clean up accidents immediately with your bleach solution. And ventilate the area well because norovirus particles can actually become airborne during vomiting episodes. One of the most important things we teach at Health Treatment Center is that you should stay home for at least 48 hours after your symptoms completely resolve. I know this is difficult, especially if you're feeling pressure to return to work or school. But this waiting period is crucial for preventing outbreaks in your community. Let's talk about some common mistakes people make when dealing with norovirus. First, they try to treat it with antibiotics. Remember, this is a virus, not a bacterial infection. So antibiotics are useless and can actually make diarrhea worse. Second, they return to normal activities too quickly, inadvertently spreading the virus to others. Third, they don't take the cleaning and disinfection protocols seriously enough, allowing the virus to persist in their environment. The psychological impact of norovirus shouldn't be underestimated either. Sudden violent onset of symptoms can be genuinely traumatic, especially for children. Having a family emergency plan for dealing with stomach illnesses can help reduce panic and ensure everyone knows what to do if someone gets sick. As we head into peak norovirus season, remember that knowledge is your best defense. Understanding how this virus spreads, recognizing the symptoms early, and knowing how to properly disinfect your environment can make the difference between a single case in your household and a family-wide outbreak. Here at Health Treatment Center, we believe in empowering you with the information you need to protect your health. If you found this information valuable, make sure to subscribe to our channel and hit that notification button so you never miss our latest health updates. Share this video with your family and friends because the more people who understand how to prevent and manage norovirus, the healthier our entire community becomes. Remember, while we provide educational information here at Health Treatment Center, this content is not a substitute for professional medical advice. Always consult with your healthcare provider if you have concerns about your symptoms, or if you're caring for someone who may be severely dehydrated. Stay healthy, stay informed, and we'll see you in the next Health Treatment Center video, where we continue to give you the tools you need to take control of your health.